Hi everyone. In today's clip, I will talk a little bit about chronic kidney disease or CKD. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Chronic kidney disease or CKD is a progressive condition where the kidneys lose their ability to filter waste and excess fluids from the blood. It's classified into 5 stages based on the filtration rate or GFR, with stage 5 being end-stage renal disease or ESRD. Now, symptoms include fatigue, nausea, vomiting, swelling in the legs, ankles, feet, foamy or reduced urine output, high blood pressure, muscle cramps, dry, itchy skin, trouble concentrating, and sleep issues. Causes are normally contributed to diabetes, hypertension, glomerulonephritis, polycystic kidney disease, polycystic kidney disease, autoimmune disease, prolonged NSAID use, and so on. So your kidneys filter waste, balance fluids, and regulate minerals. When they're impaired, certain nutrients and fluids can build up in the body, causing further damage. A kidney-friendly diet obviously is going to help. For example, reduce the workload on kidneys, control the blood pressure and blood sugar, prevent fluid overload and electrolyte imbalances, and also do a kidney cleanse. Overuse of salt and sugar are not just bad for the kidneys. They harm the overall endocrine system and leave you tired and listless. When you're using salt, try natural sources and not the regular table salt. Use like Himalayan or Celtic or any other sea salt, and don't forget to manage your sugar intake. Remember, you're not just directly measuring how much sugar you put in your tea or coffee, but everything else that goes into the system and turns into sugar. Avoid processed and packaged foods, and if you really have to eat canned foods, rinse the canned food before eating. Take less direct protein because protein metabolism produces waste that kidneys have to filter. Don't worry about if you are getting enough protein, because if you are having enough fresh fruits and vegetables and legumes and grains and things like alfalfa, wheatgrass, clover, soybeans, barley, oats, and etc., you're good to go. However, if you're already on dialysis, then you need to increase protein to compensate for the losses. And the sources can be lean meat, fish, eggs, beans, lentils, and nuts. Also, potassium is a mineral found in many foods. Your body needs potassium to make your muscles work, but too much potassium can be dangerous in CKD. If your kidneys aren't working well, they no longer can balance the minerals in your blood. This can lead to a buildup of potassium and phosphorus in the blood. High or low potassium levels affect the ways that your muscles work. Major sources of potassium include potatoes, tomatoes, melons, oranges, orange juice, bananas, dairy products, and salt substitutes that contain potassium. Also, healthy kidneys keep the correct amount of phosphorus in the body. When your kidneys are not working well, phosphorus can build up in the blood. Foods highest in phosphorus are convenience or fast foods like processed cheese, packaged foods, and many cola drinks. Check the ingredients in the products that you use and you want to buy to find words like phos in them. Examples being calcium phosphate, phosphoric acid, and more of this kind of ingredients, and avoid them. Next in the topic of fluid is the topic of fluid intake. Your body needs liquids to function properly. However, people with CKD will be asked to limit how much liquid they consume because damaged kidneys can't remove extra fluid. And this can bring about edema and or shortness of breath. I need to sort of jump in here for a second and also remind you that kidneys or no other system in the body works in isolation. Everything is related. It's not just kidneys that clear fluids. You also need to make sure that your lymphatic system is clean enough also to sort of drastically help out. I have a clip on lymphatic system that you might be sort of finding useful at this point if you want to listen to it. So in general, it's recommended to focus on whole foods, fresh fruits, vegetables, whole grains within potassium phosphorus limits, and avoid processed foods. Use olive oil, nuts, and seeds instead of saturated fats, and basically try to cleanse and be kind to your system in general. The first line of recommendation in traditional medicine usually is blood pressure control. If they see that you have above 130/80 blood pressure, they might prescribe ACE inhibitors or ARBs, which are commonly used. Blood sugar control, especially important for diabetic patients, which they target HbA1c of less than 7%. They will ask for overweight sort of patients or for weight management, encouraged through diet and physical activity. Also, you would need to stop smoking as well as stress management. Commonly prescribed medications are ACE inhibitors, as I mentioned, and ARBs to reduce abnormally high levels of protein in urine. ACE inhibitors come with a list of side effects, like creating high potassium levels, increasing creatinine, persistent dry cough, swelling of the face, lips, tongue, and throat, and so on. To be honest, I'm completely on the fence with this one because it somewhat creates what we want to get away from. Nonetheless, the second type is SGLT inhibitors for diabetic patients. SGLT is sodium glucose cotransporter 2, which is a protein that is found in some parts of our kidneys, and its main job is to reabsorb glucose and sodium from the urine back into the bloodstream. In people with CKD, especially those with diabetes or high blood pressure, this reabsorption can contribute to kidney damage over time. So SGLT2 inhibitor prevents this reabsorption. These medications also, of course, have side effects such as increased urination, thirst and dehydration, dizziness or low blood pressure, genital yeast infection or genital infection in general, UTIs, diabetic ketoacidosis, decreased bone density and fractures, hypocalcemia, especially if they're mixed with insulin and other diabetic medications. They also prescribe statins, which are conventionally used to manage cholesterol, because high cholesterol levels in CKD patients increases the risk of cardiovascular ailments. I have a clip on cholesterol management, which you might find useful at this point. Statin medications have many side effects, including muscle pain and weakness, liver enzyme elevation, digestive issues, mental fuzziness and memory issues, risk of acute kidney injury, as well as potential for worsening kidney function, and also not be prescribed to those that are already on dialysis. There's also diuretics, are another set of medication that may be prescribed to manage fluid overload and hypertension. These medications cause electrolyte imbalance, dizziness, headaches, and more. Then there is phosphate binders and vitamin D analogs, which are used to manage mineral and bone disorders in advanced CKD. So the phosphate binders are prescribed to bind to phosphate from food in the gut to prevent absorption and excrete them through stool. Vitamin D analogs converts the inactive vitamin D to active vitamin D to increase calcium absorption and suppress parathyroid hormone. However, put this together and the side effects will be constipation and bloating, vitamin D absorption interference, aluminum toxicity, nausea, headache, fatigue, soft tissue calcification, and a bit more. On the orthomolecular and nutritional side of this, we normally ask for patients to take niacin plus sodium bicarbonate, food-grade baking soda basically, which is shown to reverse all stages of CKD. So we ask the patient to take 100 to 500 milligrams of niacin Immediate release, not niacinamide, 3 times a day, along with 1/4 teaspoon of sodium bicarbonate, with less than 2 grams a day of elemental calcium as calcium carbonate, plus quercetin, which will manage phosphate levels as well as protein in the urine. It's a good idea to have a blood and urine test at the start as the base, and then at the 3 months and at the 6 months time to monitor improvements. So calcium carbonate is the most frequently used to bind the readily available intestinal phosphorus. This is among the cheapest and most effective phosphorus chelator approaches. I also have a clip on niacin and its many uses, which you may find actually helpful at this point. Then there's vitamin D3 and K2, which is essential for calcium phosphate balance, often deficient in CKD patients. Vitamin B complex, which supports red blood cell production and energy. Omega-3 fatty acids for their anti-inflammatory properties and support of cardiovascular health. And the herbs to avoid, which are not safe for CKD, are licorice root, goldenrod, cat's claw, stinging nettle, parsley root, and yohimbe. But stinging nettle seeds and leaves are awesome when it comes to kidney support, when the person has healthy kidneys and wants to do a cleanse, as well as cleavers and parsley juice or parsley tea. So in general, supplementation with daily dose niacin reliably reverses a large amount of the functional loss. This simple treatment is effective and critically important. On the metaphysical, emotional, and spiritual side of this ailment, kidneys are linked to fear and security. Fear of loss or abandonment, difficulty making decisions, feeling unsupported or ungrounded. Kidneys being filters also symbolize emotional purification and intuition. Healing practices for this includes meditation, journaling, breath work, root chakra balancing, energy healing, and emotional releases. Try to address unresolved trauma and chronic stress, as well as grounding exercises and affirmations. Hope this has been helpful. Like and follow for more. Be the light.